Pulmonary embolism can happen suddenly, but with the right knowledge, it can be recognised, treated, and even prevented. In this episode, Dr. Aman Sharma explains what a PE is, what to watch out for, and how life can continue after a diagnosis with the right support. Let's dive in.
Hello, everyone. Welcome back to ThromboWatch. I'm Dr. Aman Sharma, internal medicine doctor. And in today's episode, we'll be talking about pulmonary embolism. If you watched our last podcast with our guest, Glenda, she talked about pulmonary embolism and how catastrophic it was for her family. In today's video, we'll dive in a little more deeper what pulmonary embolism is and basically try to make a guide for you all so that you understand what this pathology is, how troublesome it can be, what are the symptoms, how can it be prevented, what are the treatment options, and how is life living after pulmonary embolism. So if you don't know much about pulmonary embolism, this is the exact time you dive into this video with me. Before we go ahead, I just want to make a disclaimer. Guys, this is for education purposes only. If you, however, have any red flag symptoms, which I will discuss later in this video, please and go and attend your doctors or the A&E departments. So when I talk about pulmonary embolism, you all must have heard the clot in the lungs, the clot in your chest, and these are the common things that people usually talk about. But you also know that this is caused by clots that might travel from other parts of the body to the lungs. What I'll do is I'll try to demonstrate this onto your minds by this simple animated video. So as you can see, the circular structure which is going up, it is the clot. It's gone into the heart, and from the heart it goes into the vessels which supplies your lungs, thereby causing a big sort of chunk in your lungs which does not get blood. If it does not get blood, it does not function. If it does not function well, it does not let you have the oxygenated blood. So it's a very, a domino ripple effect, essentially, one clot causing this after other another. But the thing that we need to be a bit watchful for is you might not know how big the clot is, but your symptoms might tell us how bad the clot can be. So if you have the red flag symptoms, which I've of course discussed later, you should go to the hospital and not sit at home. This can be potentially life threatening. You must think in a simple way. There's a traffic jam, and the traffic jam is happened in one of your blood vessels which supplies the lung, thereby causing a severe disruption and causing the symptoms. So who is at risk of pulmonary embolism? So I've just simplified into three broad categories. If you're any of these, yes, you might have the risk. Doesn't necessarily mean you will have the problem. So number one is immobility. So this is the biggest factor. Immobility can be caused because of your circumstances, as in if you're driving long or you've been seated long on a long flight, long train journey, anything where you're static and you're not moving. Other thing could be an extended bed rest, of course, if you're recovering from sickness, illness, transplants, back problems, this can be essentially one of those reasons. The last would be recent hospitalization or a big surgery, because when you come to the hospital, again, it is a sort of immobilization where you cannot move much. So that can also be a precipitating factor. On Other than this, you might have some medical conditions which might have a further risk. First of all, if we talk, of course, the genetic conditions, we've talked in many of our podcasts where you have previous blood clot problems in your families. You have got a family history of someone getting a clot in their legs, clot in their lungs, clot in their heads, anywhere, any sort of hypercoagulable state that can essentially cause it. If you talk about cancer and chemotherapy, again, cancer is again a condition where you become hyperviscous, your blood becomes thick, and there is always a risk for you to develop a blood clot. If you previously had heart or lung problems, including hole in your heart, as we say, these can also be conditions that can cause your irregular rhythm in the heart, can also cause blood clots, cause strokes and stuff. And the last but not least is pregnancy and postpartum period. Again, pregnancy, your body is going through a lot of changes, physiological changes, the dynamics are changing, the volumetrics are changing. This can increase the risk of clots, just not increases throughout the pregnancy, but also during the postpartum period, because your hormones and the bloods and everything are still playing up. And this can precipitate blood clots. The other risk factors are, of course, hormonal replacement therapy. Be it for any reason, you've got hormonal problems which are affecting your pregnancy, or you're having to take hormonal replacements to avoid pregnancy, you're having hormonal replacement therapies because of some cancers, or also because you are coping with menopause. Obesity, of course, anything, because again, obesity is a ripple effect, isn't it? You'll get obese, your mobility would decrease, your body's dynamics of pumping the blood everywhere in your body would decrease. Smoking always has been associated with so many conditions, and it can work in multitude of ways just to cause some harm to the body. And increasing age, which again, your blood vessels become stiff, they are not that flexible, and that can also increase the risk of hypertension. But it can also increase the risk for you to have pulmonary embolism. So usually it's just not one single factor. It's usually a combination of few significant factors, and that's what increases the risk of someone developing a pulmonary embolism quite significantly. So you need to recognize the symptoms now, isn't it? Because if you know the symptoms, you can prevent yourself. If you don't know the symptoms, you might just take a wild guess and just be at your home. So we'll talk about the primary symptoms. If it is involving the lungs, you would have your lungs involved. You would have a breathing difficulty, minimal activity, shortness of breath. You will always. Most of the patients do accompany with breathing difficulty. The second most common symptom that we usually see is chest pain. Again, because the blood vessels in the lungs are not working well, the lung is trying to compensate. It affects the heart, and eventually you can have heart problems. Also, the lung itself, if it's getting devoid of blood, it will cry for pain, and that's how you would relate it with your symptoms. And you can also have irregular heartbeat or palpitations, as we usually call. People have also expressed that they felt dizzy at times without any obvious chest symptoms. So, if you talk about the additional symptoms, you might have coughing, you might be spitting some, as we call it, is a pink frothy sputum or expectoration, but it's not mandatory that everyone will have it every time someone will complain of it. You might feel lightheaded, dizzy, or as if you're going to faint, because now the dynamics in your heart and your lung has compromised, and that's causing this. You might sweat. Again, you might feel dizzy, you might sweat. Few people have reported fever, and you also need to look for your legs if there's any obvious swelling or pain or something which might say that, oh, you might had a clot in your legs, and that has gone to your lungs, as we saw in the animation before. So, unlike normal breathlessness, the pulmonary embolism would typically be there, and it does not improve with rest. Whereas if you've got other lung problems, if you've got asthma, COPD, when you sit down, it eases a bit. If you've got heart problems, angina, again, you sit down, it eases a bit. But pulmonary embolism, the symptoms stay there. They do not go away. So, how do the doctors diagnose pulmonary embolism? For us, it's not like just one single parameter. The first and foremost is very important, and that's the clinical assessment and history. We will ask you lots of questions. We will do a clinical exam, try to listen to your heart, try to listen to your lungs, see what your vital signs are saying, as in your blood pressure, your heart rate, your respiratory rate, your oxygen levels. Usually, people with pulmonary embolism who are quite sick, their blood pressure is low, their heart rate is up, their respiratory rate is up, and oxygen levels is low. But this is not a very fixed parameter. People can have different sort of things, but in general, this is what we usually see. When we investigate people, you would see blood tests. These blood tests can be many things, but the one that we usually look for is called D-dimer. It basically measures if there's any sort of inflammatory activity going in the body, and this can be measured because it measures the protein fragments that are related to the blood clots. And if it's high, not just high, but high significantly, that can be parameter for us to think whether someone's got blood clots or pulmonary embolism. Number three would be imaging. Of course, the standard test for this is the pulmonary angiogram. So we insert a needle in your arm, check your kidney function and stuff. We put you through a CT scanner machine and push some special dye through the veins and see if your lungs are getting filled, if there is a defect or filling defect or something. However, if the person is younger, If they're still in childbearing age or they're pregnant, then we usually go for a ventilation perfusion scan. It is similar to the CT scan. However, the availability usually varies from trust to trust, and it's a very specific test which can be done by specific people. So we usually prefer CTPA on comparison to the VQ scan. But again, depending on the availability where you're getting treated, this would be a bit different. If someone's got a clot or someone's got a swelling in their legs, looks inflamed, red, hot, more swollen compared to the other leg, then we usually do a Doppler scan, the jelly scan of the legs ultrasound, and there we can see whether they've got clots or not. Additional to all of this, we do check the tracing of your heart, the ECG, to see if there's any funny rhythm going on or you've got irregular pulses or anything. And then we also can do a jelly scan of your heart because, see, as I said, your lung and your heart, everything's connected all together. One thing doesn't working well will affect the other. And this is what we can see. So the heart becomes in a very strained position and it becomes difficult for it to pump blood and do your daily bits. So what are the treatment? Number one treatment, guys, it doesn't need any medication. It needs you to be in the hospital because if your oxygen levels are low, you need oxygen. There is no other supplemental thing that we can bring in for that. If your oxygen levels are low, you need oxygen, plain and simple. Then we come and think about the other factors, the other medications that we can give you. If you're relatively stable, if your blood pressure is stable, if the clot shows that it's affected a very small part of your lung, then we might give you something called as anticoagulants. It can be many medications. It can be warfarin, which we used to give in the past, but now it's relatively advanced medicine. We can give you apixaban, rivaroxaban, roxaban, depending on how you are, how your other conditions are, how your kidneys are functioning and stuff. If the patient is unstable, then we go for thrombolytic therapy. So we give you very special medications through the veins, which go and try to dissolve the clot, thereby removing the traffic jam and basically making lungs function again. The rare one is surgical intervention. If nothing's working and very critical patient, then we might try to get the clot out. It's called embolectomy. And basically, it's reserved for very special cases, not done on a day-to-day basis. So now the treatment begins immediately when there is a clinical suspicion, and then with this further confirmation, whether or not it's life-threatening or not, it doesn't matter because it needs to be treated, it needs to be assessed, it needs to be seen. Okay. So whether it's life-threatening or not is a very clinical decision for you as a patient who's got symptoms. Your first job here is report it, get it seen, and don't cause any further delays just by giving it an element of doubt or this is not life-threatening. It can be. So I've talked about so much, and this is what I've talked in my previous videos and podcasts as well. But today I'll talk a bit different. How is life living with PE? And after, first of all, we'll divide into three basic groups. So number one is your acute ongoing care. So of course, if you've got clots in the lungs, we will prescribe you special medications, the anticoagulants, which again would be somewhere between 3 to 6 months time, depending if it was caused by any specific thing, which we call as provoked, or it just came out of nowhere, which we call as unprovoked, depending on the risk assessment, whether you need it for a specific time or you need it through your life, is what we'll make a call on. Of course, at any point, if the person is thinking of, if it's a young woman and they're planning to conceive a family, they should discuss this first with their doctors because we need to stop those oral tablets and put them on the injectable ones, which go into the tummy because that are the safer ones for pregnancy. So not when you've conceived, but before you're planning to conceive is when you need to go to your doctor and discuss about it, or your acute doctors or your hematologist, so whoever you've got in contact with. Of course, we need regular following appointments. I worked in acute medicine and we used to do the VT clinics. We used to see people usually every 3 months and basically bring them in, see how the bloods are doing, and then make a decision whether we can stop the meds, not stop the meds. We need to still monitor you for the bleeding complications because these medications, though, are a blessing, but they also come with side effects where they can bleed and potentially bleed a lot. And whether we need to check the levels of these medications is what the ongoing medical care is all about. So once you've gone through that period and you are also transitioning into your normal life, which can take a couple of months, then you also need to make sure that about your lifestyle adjustments, which is, the talk that we all talk these days, isn't it? Lifestyle medication, lifestyle modifications and stuff. So You need to gradually come back to your baseline. If you used to walk 2 miles, you won't be able to walk 2 miles straight away. You'll have to pick it up gradually, half quarter mile, half mile, 1 mile, and then you go there. Also, if you were obese, if you had any sort of dietary problems, lifestyle problems, stop smoking, work on your diet, make sure you get in touch with the dietitian so that you can work on and gradually bring it down. Avoid alcohol while you're still on the blood thinners. They can cause interactions. And wear the stockings if recommended, as you've heard in many of our podcasts from people who experienced blood clots, whether they had factor 5, whether they had protein C, protein S deficiencies, whether they had antiphospholipid syndrome. All of these patients have shared one thing very common, that they weird compression stockings whenever it was needed. Then, of course, there's this component which no one talks about. It's a psychological support, isn't it? Because having a clot is big, isn't it? It's something that you'd never expected but has come to your life. So people talk about various other support groups, but I haven't seen much support groups about people living with blood clots. And that's what we're trying to create here on ThromboWatch. We want to create a community of people like you who've suffered blood clots, and you want to be vocal about it, talk about it, so the other people who are at risk might be saved. And if God forbid they do get these clots, they've got somewhere where people similar to them, their own tribe is there, and they can help them come out of this blood clot problem. And of course, dealing with the activity limitations is something we need to talk, because this should be a gradual process. Because usually, if you've got a knee replacement, people will tell you, oh, go to the physio, do this exercise, do that exercise. But if you had a blood clot, you basically are just left on the medications, and there's obviously not a robust network or system in place that could have made it much more better. And again, talk about it. As we say, we are trying to build a community on ThromboWatch, but if you've got any further ideas and you want to get involved, get in touch with us. We'll definitely try to make something for you. How can we prevent it? Of course, we are in an era where preventive medication is being pushed more. So you need to be active as much as you can. So it's avoid prolonged immobility. If you're going onto the train, walk onto the train. If you're going onto the ship, walk onto the ship. If you're going onto the plane, walk. It's just get up from your seat, walk every 1 to 2 hours, couple of steps. Yeah. If you're bedridden, try to move your legs up and down. Your calf muscles will be moving, and those are the biggest pumps other than your heart. So if you can do that sideways, backways, anyways, that would help you. Hydration. All of us love hydration. This is my bottle. I do bring it, and I do try to drink whenever I can, but it's not always possible. But wherever you are in your workstations, do try to drink, especially in the warmer seasons, because that basically keeps your blood dynamics quite well. Your blood is made up of predominantly water. If you drink more water, that does help the blood. But yeah, you do have to make a consideration. If you've got heart problems, kidney problems, that needs to be restricted as per the advice of a physician. Compression stockings, we've seen those, what to say, dull white or skin colored stockings. I just want to ask you all, what do you think if we brought in colorful stockings, people would wear them more? If you think yes, just drop your opinion onto the comment section. But yeah, compression stockings help if you are aware and if you are well versed with it. Otherwise, it doesn't work well with people, because putting them on is also an art which you need to learn after a couple of attempts. And of course, know your own risks. If you are trying to do something, make a big change to your life, get your doctor involved, get your physicians involved. As in, if you're trying to go for a big bariatric surgery to reduce weight, it's just not the surgery that's going to help you. It's a complete journey. So just going on very rampant measures is not the pragmatic solution. Take it slow and it will fall into place. But you can always prevent pulmonary embolism with very basic things in your life. What if we don't treat it? Okay, so many people, as I said, they say, fine, I'm not going to have a treatment. But if we leave it untreated, then you might have pulmonary hypertension. You've heard about hypertension, blood pressures. The same way, your lungs pressure also increase, and this basically hampers your oxygenation levels, because you've got blocked blood vessels. It's causing a strain in your heart, overall increasing the pressure inside your lungs and your heart and everywhere. Because of this, there's something that you can have a reciprocal effect, in which your right side of your heart, from where you get the deoxygenated blood, it might be pumping against a very, what to say, resistant lung, in terms of, because you've got a clot and you've got a traffic jam, as I said, and so the traffic jam is going to get backlogged many miles. The same thing happens with your lung and your heart, and the heart basically pays the price. It can cause permanent lung damage, because if that area dies off, it dies off. You can't get it better. The tissues are dead. They are dead. And unfortunately, the inevitable in untreated patients can be death. See, we keep talking about death, this, that, death. But see, if you don't treat pulmonary embolism, it is very strongly associated with sudden cardiac arrest. And it's a medical emergency where you can't just ignore it. Otherwise, there can be serious life threatening, and what to say, in the longer run, this would be affecting your quality of life and everything. So, when do you think you need to attend the hospital or call the medical services? Of course, if there's a sudden shortness of breath, there's a chest pain, you are struggling to breathe, you're feeling dizzy, if your family might think you're looking pale, blue, you're getting fainted, you had some loss of consciousness, you've been coughing up blood. These are the extreme red flags, guys. If you have this, there is one option, and one option, 999. If you think the symptoms were not that mild, then go for 111. But most of the patients, I would say, call the main helpline rather than just sitting and getting it seen by your GPs, because this is a medical condition that needs in-hospital treatment. Your GPs won't be able to help you much on this. They can help you once the acute phase is gone, and then you're talking about the lifestyle and the psychological safety aspect. But other than that, no. Of course, you should remember, PE also mimics other conditions. It can mimic heart attack. It can mimic rupture of the blood pipe, which we call as aortic aneurysm. But yeah, if you have any of these symptoms, ladies and gentlemen, don't think twice. Call the ambulance, call for help. And if we talk about your recovery output, of course, with proper treatment, the proper treatment is just not the medication, it is the lifestyle, and also the psychological support, the community support that I was talking about earlier. You can reach your baseline of your life about 3 to 6 months' time. You can gradually return to your normal activities. If you've treated and you've coped well, there is very minimalistic, or to say, long-term effect of this condition. People do feel a bit short of breath, but it's one of those things that we develop that strength, and you develop that endurance, and you can cope up with it with developing your physical endurance, isn't it? While few people might actually need lifelong anticoagulation because the risk factors and the stratification. So if this is happening, don't be worried. It's a pill. We understand it might make you very anxious. There are few risk factors as well. But in a longer aspect, if you need it, then you need it. So thank you so much, ladies and gentlemen, for listening. I've requested this to you all before, and I'm requesting this again. If you, your family, friends, someone in your family has suffered any blood clot problems and they want to come out and talk to us, spread the word, spread the information, and basically create a sort of revolution, I would say, so that people living with blood clot disorders don't feel left out and isolated, and we create a better community for them. So I'll see you in the next podcast. Thank you so much.
This podcast is for informational purposes only and does not constitute medical, legal, or financial advice. The views expressed are the personal opinions of the ThromboWatch team. If you think you may have developed a blood clot, please speak to your healthcare provider urgently. Health-related information shared in this podcast, including text, graphics, images, and other material, is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or another qualified healthcare provider with any questions you may have regarding a medical condition. If you believe you're experiencing a medical emergency, call 999 in the UK. For less urgent support, call 111. Thank you.